Hello, my name is Ellen Chambers, and this is my HSO presentation for the Holistic Medical Institute in Chicago, Illinois. During this presentation, I will address the following topics as well as ask a few discussion questions toward the end of the presentation. The type of HSO that I have created is a small, integrative, and holistic healthcare center that focuses on preventative care and combines both alternative and conventional therapies. The center's focus is in response to the growing number of Americans suffering from chronic illnesses and the lack of preventative care used. The center's therapies are designed to treat chronic illness, cultivate wellness through nutritional counseling, neuromuscular and skeletal therapies, and mental health therapies. According to the Department of Health and Human Services, users of alternative therapies come from a variety of backgrounds. However, those most likely to use these therapies are women with higher levels of education and a higher socioeconomic status. Because of this, I have chosen the Roscoe Village neighborhood on the north side of Chicago as my location. As you can see, the demographics of Roscoe Village closely match the target demographic of alternative therapies. The population of Roscoe Village is over 10,000. 91.4% of the people living in Roscoe Village have an education higher than high school graduate level. The median household income is $74,000. Those under 65 without insurance are only 5.3%. So most of the people in Roscoe Village have insurance, and over 50% of the population is female. Chicago has a large market of alternative medical centers. Not all of the centers have been around for a long period of time. In Chicago, alternative medical centers have a tendency to come and go rather quickly, although there are a vast number of them. The city of Chicago has over 300 alternative medical centers. Roscoe Village itself also has many centers, including the two that I have listed here. The first is Chicago Holistic Medicine. Chicago Holistic Medicine focuses on things that my center will also focus on, such as nutritional counseling and stress relief. They also offer massage therapy, which is not one of the services that my center will offer, but their focus is very similar to the Holistic Medical Institute's focus. Another center in Roscoe Village is called Pro Holistic Acupuncture and Chiropractic and Acupuncture, They offer chiropractic care and just like Holistic Medical Institute, and they also offer nutritional care, just like my center does as well. And they work toward chronic disease prevention, which is very similar to my center. So as you can see, there is pretty heavy competition in this area of Chicago for alternative medical centers. Holistic Medical Institute will be a relatively small center. The design will consist of a governing board, president, an office manager, practitioners, and an administrative staff. The office will employ 9 people. Although the president will report directly to the governing board, and the office manager practitioners will report directly to the president, and then the administrative staff will report directly to the office manager, The office will run on a day-to-day basis. The office will run in a very fluid way because the office is so small. The every member of the office will hold quite a bit of importance to their position. So an open policy in the office will be very important. It will be not quite so rigid, much more fluid and collegial. Everybody will have an important role to play. Holistic Medical Institute's governing board will hold 4 people. 2 of the members will be doctors of medicine, so that the center can keep up with the newest information in medicine. 1 member will be a public health professional in order to keep things simple and effective based on available data. And finally, we will employ an MBA to help the business run as smoothly and efficiently as possible. The mission statement of the center is very simple. Our purpose is to enable our patients to become a true creator of their own health by helping them cultivate a deep connection with themselves. The values that we will uphold are a deep understanding of the human body and what it means to be healthy, education and patient autonomy, integrity and respect, creativity and innovation, and finally, simplicity and effectiveness. One of the most important values that we will employ at the center is a deep understanding of the human body and what it means to be healthy through educating the patient. We believe that people have more control over their health than what many people realize through nutritional counseling and teaching our patients about stress relief, coping mechanisms to handle what their lives are handing them. We believe that we will be able to empower the patient to know how to make healthier choices in their lives and really prevent those chronic illnesses that so many Americans are suffering from, like heart disease, obesity, diabetes, things like that. Most of these diseases are connected to health through food and nutrition and lack of exercise. Therefore, we believe that we can teach people how to prevent these chronic illnesses through very, very, very simple and preventative measures. And what we hope is that all of the patients that come through the center will feel more capable and more autonomous and more in control of their own health. Our strategic plan is a 6-month process to create a 5-year plan that should be mostly implemented by the 2-year mark once it has been started. The strategic planning will include the governing board, the president, practitioners, and the office manager. Again, because this office is so small, most of the office will play a big role in even, some of the bigger picture concepts like a strategic plan. In some smaller ways, the office manager or the president would even take opinion from the administrative staff because everybody works in such close proximity with each other. Here's my SWOT analysis for the center. I believe that some of its strengths are its low overhead, the diverse governing board, and simplicity in its therapies. Hopefully, by keeping costs low and by promoting simple and effective ways for people to treat chronic illness or just to maintain their wellness, we can more easily turn a profit. Some of the weaknesses are that we offer services that may not be reimbursed by certain insurance companies, which is definitely a deal breaker for many people because out-of-pocket expenses in medicine are high. Some people also have some negative associations with alternative care. We're hoping that because we are combining some more conventional therapies with alternative therapies, then we can make alternative therapies more accessible for people that might otherwise try to avoid alternative therapies. Another one of the weaknesses in this center, as is for many centers, is that the hours will be long and the pay will be low up at the start. So again, hopefully by keeping the overhead as low as possible, we will be able to turn a profit. Some of the opportunities are a growing interest in alternative care. People have been using alternative remedies for many years, and over the last 15 years there's been an increase in interest in alternative therapies, especially with the millennial generation. So that's a huge opportunity. The location, the demographic of the location very closely matches the target demographic for alternative therapies, which is another strength. There's also a great need for all preventative care in America in general, which is what we're offering. Some threats to the center are heavy competition, as I laid out previously. Because of the new administration, there will almost definitely be changes to the Affordable Care Act, which can affect people's coverage, which would also affect the number of patient visits per year at the center. And also there are, critics of alternative therapies, which can definitely be a threat. The following two slides are going to cover marketing strategies. The 4 Ps for the center are as follows. The product is preventative and wellness care, chronic disease care, mental health care, and stress management care. That's basically what we're offering at the center. The place that we're offering the services are in one location in Roscoe Village in Chicago, Illinois. One of the long-term visions of the center, however, is to open another location in an area that has a higher demand for preventative care. I would really love to see this clinic or this kind of center flourish in areas like West Garfield Park or Englewood on the south side, where the rates of chronic illness are even higher, much higher than they are in Roscoe Village, where those people really could use some comprehensive education about preventative measures to keep chronic illness at bay. The price for the service will come through reimbursement from Blue Cross Blue Shield and Medicare, and then also some Medicaid. For everything not covered by Blue Cross Blue Shield, Medicare, or Medicaid, we will require out-of-pocket payments from the patients. In order to make sure that we get payment from the patient for these out-of-pocket expenses, the patient will have to sign paperwork that says that they agree to leave a credit card at our center, and that we will charge the credit card if it has not charged the credit card for services that have not been paid as of 60 days. So we will try to keep all of our accounts receivable 60 days or younger. We will promote the center in a variety of ways, a website, social media, signage on the building, Yelp and Google, but we will really rely heavily on patient referrals at our center. So it will be required that all of the practitioners will attend social networking events throughout the city on a weekly, bi-weekly, or monthly basis, so that we can keep patient referrals, personal referrals coming into the center. The next couple of slides will go over basic financial information. We will begin financing with a $50,000 loan from a bank and a $10,000 grant from a fundraising event. The startup costs will look about what I've laid out here. We'll need to establish an LLC, which will include attorney's fees, CPA, licensing, etc. Office expenses will be about $11,000. Marketing costs will look at about $4,500, which will include building a website and hiring a marketing consultant for the establishing the logo and the look of the website and color schemes and things like that. Because of the loan, grant, and the startup costs, the funds for the first year of the business will look very different from the second year and beyond. After the first year, once the center is at a fuller capacity of patient visits, we can expect to see about 7,592 patient visits per year and about a $456,000 a year revenue. The center will live in a small deficit each month. As you can see, the monthly expenses are $42,845, and the net revenue is $41,700. Another long-term vision of the center is to open a small store to help offset the costs of the practice. Here is the 12-month timeline for the opening of the Holistic Medical Institute. The first few months will focus on finances and state licensing, as well as creating a business plan. The next phase will focus on environmental and marketing necessities such as location, website creation, marketing consulting, meeting with local businesses, and holding a fundraising event. Months 7 through 9 will focus on purchasing items for the office, finalizing the lease agreement, moving into the office, and then interviewing and hiring the staff. The final 3 months will focus on organizing the office, training the staff, installing electronics and software, and then holding our first company meeting, and finally accepting patient visits. During this presentation, we discussed the type of HSO and services provided. We assessed a market analysis. I described the organizational design and governance structure. We outlined a strategic plan and SWOT analysis, outlined marketing strategy, reviewed basic financial information, and reviewed a 12-month timeline. And just to end the presentation, I have a few discussion questions. First, what do you think the biggest challenge for this HSO will be? Second, as public health professionals, how can we encourage preventative care in America? And lastly, what other kinds of preventative healthcare measures should this HSO offer? And finally, here is a list of my references. Thank you so much for listening to my presentation of my HSO. I hope you enjoyed it, and I very much look forward to watching all of your presentations.